Welcome to On Track. I'm Aisha Jaffer. The start of the school year can be exciting, but also overwhelming. For kids, balancing academics, friendships, social media, and even the world around them can put pressure on their mental health. Today, we're talking about how parents, caregivers, and communities can help kids stay mentally healthy, not just when they're struggling, but as part of everyday life. Joining me is Dr. Katie Hopkins, Executive Medical Director of Pediatric Behavioral Health at Norton Children's. She's a licensed psychologist specializing in children, adolescents, and families. Dr. Hopkins holds a doctorate in philosophy and a master's of education from the University of Louisville. Dr. Hopkins, thanks for being here today on Track.
Thanks for having me.
So what emotional or behavioral issues do you most commonly see when kids head back to school, and is there a set adjustment period?
Sure. So I think we can all remember going back to school and the nerves, right? I think anxiety is our most common and reasonable emotion we have when we're starting something new, when we're establishing new routines, when we're not sure what to expect from a new teacher, a new classroom, sometimes a new school, definitely a new school year where you're learning new things. So anxiety is the most common thing that I see. And then, certainly there's different trends depending on maybe if there were changes from the year before that impact the school district or the school themselves. And so, to use an example, this year our local school district has implemented a cell phone ban. And as many school districts have done, around the country in the past year or so, that was supported by legislation to really see that change happening. And the first week of school, I was getting phone calls in my office from parents talking about their kids and their teenagers struggling to adjust to, interestingly, not having their phone so that they could contact their parent. It really revealed how often even teenagers were using their cell phones to kind of constantly and routinely communicate with their parents throughout the school day, whether it was just about very basic things like who's going to pick me up after school, to getting emotional support throughout the school day. So that's been particular to this school year, but I think it falls in line with the, typical anxieties of not knowing what to expect and having new routines and having to adjust to them.
I mean, I immediately thought of my time, just like, who am I going to sit with at the lunch table kind of thing?
Yeah, totally. Totally. What if my friends aren't in my class?
Right.
That's a big concern. Or, I don't know anyone and they're all in that class together. What if they, leave me out and they stop inviting me to things? Those are really normal things that we've all remember experiencing.
Absolutely. So then speaking more generally, like what are some of the most common mental health challenges you see in young people, and how do those challenges sort of change from, early childhood to adolescence?
So certainly in early childhood, we tend to see more concerns related to their behaviors. I mean, behavior is always an indication of our feelings, but particularly when we're younger and we don't have as much ability to process things verbally, it tends to show itself in disruptive behaviors or maladaptive behaviors. Anxiety is also very common at that age as they go through some pretty major changes of starting school, navigating things independently, where before they had much more parent support. As they get older, certainly behavior problems tend to improve, although certainly we always have, kids that struggle in those areas. Anxiety can transition. They get more comfortable with being independent of their parents, but then social anxiety starts to certainly present itself in the middle and high school years because you care deeply and importantly, you care deeply about what your community of peers think about you, and that helps shape your identity, which is your big job when you're an adolescent. So you care a lot about what other people think about you, and certainly that can lead to some social anxiety. Similarly, we see increased depression the older that kids get. For younger kids, depression tends to manifest more as irritability. We see that in boys as well as chronic irritability versus what we think of as typical sadness. When we identify, oh, that person's depressed, we think of a sad person. But we actually, in kids and boys and men, it tends to to manifest more in just chronic irritability. But it's really about having a negative view of yourself, of other people, of the world. So we see that as people develop and they start to pay more attention to other people in the world. And so, certainly we see that, depression and anxiety being kind of the most common mental health issues.
And then, how much does a parent or caregiver's wellness affect a child's mental health? And that?
Huge, huge. So when I first started training, working with children and adolescents, I love kids. I love being with kids. And I started to pretty quickly feel like what I was doing was just like a drop in the bucket of how I could positively, enact change with this child, because I wasn't, at the time anyway, intervening with the people who had the most power to change how things were going for their child, and those are parents and caregivers. So, I certainly have shifted clinically to really focusing on caregiver and parent-focused intervention as a pathway to child well-being. If I'm not doing that, then I'm losing a real opportunity to utilize the biggest expert in this kid, which is their caregiver. And also, think about like a math teacher, right? If a math teacher only has a kid for an hour a week and then expects that kid to retain the knowledge and be able to independently practice whatever that math skill is, to be able to build on that skill the next week, not review it and then reinforce it, but actually add a new skill the following week, we would know right from the start that that would not be effective teaching. Yet our old ways of treating kids from a mental health standpoint were pretty much that model. We see you at most once a week and teach a skill and expect a child, an 8-year-old child, to independently work on those skills, even though their parents don't know what that skill is, their teachers don't know what that skill is. So we really have to utilize parents and caregivers and teachers and other caring adults in kids' lives to reinforce daily the change that we are trying to support a child through. And oftentimes we find that actually if we can get the parents to approach things differently, the change automatically happens in the kid. So, for example, reducing parent anxiety. You can't expect a kid to get less anxious before a parent is.
Right.
So, really helping support parents in having confidence in their kids' ability to cope so that they can then communicate that confidence to their children.
And so for those parents, for those caregivers, what behaviors or patterns are signs indicating for them that a child might need support?
Yeah. So certainly, I always look to functioning. Anxiety is a normal feeling. It's an emotion. So is sadness. So is irritability. We all experience those if we're healthy. In fact, it's a good sign to be anxious. If people were happy all the time, it would be problematic in its own way. And so just the presence of a negative emotion is not a sign that someone's suffering. It's when those negative emotions don't effectively lead to solving a problem. If they're really anxious about taking a test, for example, and that anxiety is actually getting in the way of them effectively preparing for the test, that would be a problem. Versus typical test anxiety that helps you make sure that you set aside plenty of time to study and prepare. That's effective use of anxiety. So when we see that people's emotions or attempts at problem solving are really negatively impacting their functioning, and when I say functioning, I mean the basics: sleeping, eating, socializing, going to school. If they're impaired in that way, because those are essential benchmarks to a healthy adolescent, then that would be an indication that they'd need some additional support. On top of course, the standard things that we think of, which is a kid coming and telling you that they feel X, Y, and Z, and that mood is persistent, right? It doesn't go away. It stays that way at high levels for a week, 2 weeks, 3 weeks.
Yeah, those examples are great, clear distinctions.
Yeah.
It's a really well put. Some young people though they face added stressors, whether from discrimination, cultural pressures, or limited resources. How do mental health needs differ for kids carrying those extra burdens, and what kinds of support can really make a difference?
Well, again, I go back to the system. We can't overly burden people who are marginalized or routinely experience, systemic oppression to say, okay, you have more of a burden and therefore are more vulnerable to these stressors, and therefore you have to do 5 times as much to counter them. Certainly, they already feel that pressure, so us adding to that would be hugely unhelpful. And that's where mental health providers' role as advocates for social change is really essential. We can't continue to say, I'll just use an example of, I used to work in a high school, and I was, encountering a lot of depressed and irritable and anxious teenagers. And as I talked about functioning with them, I was realizing that they were chronically sleep deprived. And part of that reason was the pressures of not only homework, but also family, the needs of the family. They would come home from school and have, sibling caregiving responsibilities. Maybe we're working after school until 10 or 11 at night. Those sorts of things are not easily solved, right? And maybe a part of a functioning family. That may be a well-oiled functioning family. Where it becomes a problem is if that kid has to turn around and get up at 4 a.m. to go to school. And so, really pushing, so psychologists have long pushed for later start times for that reason, is that we need to support these kids who do not have protected time after school necessarily to, go to bed early, go to bed at 9 o'clock, and, all of the things that we think in a perfect universe, they would have this great sleep hygiene. It's like, okay, well, we can't change that, but we could change something as simple as when school starts. Of course, we know it's not always that simple, but that is important from an advocacy standpoint, is that we need to be mindful not to be placing the burden of a responsibility on an individual child when it's really a systemic or societal issue that needs to have continued advocacy.
Yeah, it's really interesting. I never thought about that, the start time and how effective that could be. Now, I want to turn to something a little different. According to the Kentucky Department of Education, suicide is the second leading cause of death for youth and young adults in Kentucky. Can you talk about warning signs, prevention, and what families in Kentucky specifically should know?
Yeah, sure. So, I think it's important to understand that we have a real opportunity to intervene with kids who are struggling. And I think schools across the state, public schools particularly, which have, received state and federal dollars to screen for suicidal ideation, to offer support at least once or twice a year, that's a really crucial. So screening is really essential. Similarly, the Centers for Medicaid, which kind of also dictate what private insurers cover, require that pediatricians screen for suicidal ideation for every child seen after age 11. And so that can be done at every visit, but at bare minimum, every 6 months they need to be screened, or every time they're seen in the clinic. And so screening is really essential. Asking the question. A lot of families are nervous about coming out and directly asking their child if they have thought about suicide, if they've thought about ending their life or hurting themselves, if they have thoughts about not wanting to be here anymore. And, what I hear from parents and teachers and caregivers is, well, we're worried that if we offer that question, that it will somehow, well, I never thought about it before, so now that you mention it, I do think that. That has just resoundingly been shown to be false. Kids understand, kids even as young as 6 and 7 start to understand developmentally the permanency of death. And also because of where they're at developmentally, even into the teenage years, they have a hard time thinking into the future, right? So they have a hard time imagining things different than they are right now. And so in some ways, it's developmentally understandable that when kids are really struggling, they will consider, oh, it would just be easier if I just didn't wake up, or it would just be easier if I took my own life. The vast majority of suicide is impulsive. So mental illness actually only accounts for about 30% of kids who complete suicide. And so certainly that's the largest predictor is a pre-existing mental health condition, but we have to think about what's the other 70%. So for teenagers, it is, so the largest predictor in terms of a mental health disorder is depression. For kids, because unfortunately children also commit suicide, it's impulsivity. So an impulse control disorder is a larger predictor because they're more likely to have that as a presenting issue than they are depression. So those are the two kind of primary diagnoses that we know are potential risk factors and that we want to keep a closer eye on. So, but also thinking about, from a very basic standpoint, are they talking about killing themselves? I know that sounds silly, but you wouldn't believe how many families or how many kids I've talked to who express thoughts of suicide and their parents think that they're seeking attention or brush them off because they remember their own suicidal thoughts and they survive them without getting any extra support. So they'll just say, oh, I had those thoughts too. Don't worry about it. They go away. So certainly distinct changes in behavior in one direction or the other. You know, it could be that they were really down and depressed and all of a sudden they are acting euphoric for long periods of time. Big disruptions in sleep, in eating, in school functioning, an abrupt change in their social life, a breakup, a new group of friends that they've never had before, or loss of friendship. So relationship loss, whether that be through parents separating and they no longer are seeing one of their primary caregivers, or they break up with a boyfriend or a girlfriend or a partner. Those are all things where you really want to be closely monitoring it. Certainly things like substance use increases the risk. And the biggest predictor of completed suicide is access to lethal means. So if we're talking about suicide prevention, restricting access to lethal means universally, because we can't just say, let's restrict access if a person is depressed. Certainly we should do that, right? Is making sure that, that kids who are depressed or impulsive don't have access to lethal means. But remember what I said, only 30% of kids who complete suicide have a mental health disorder, or that's already been diagnosed. So we need to also be mindful of that 70% and consider maybe we should just be closely monitoring things that could really harm a kid should they impulsively decide to hurt themselves.
So if a family is feeling stuck or overwhelmed when they're thinking about this, what supportive resources are available here in Kentucky that can help?
Well, first and foremost, we have the suicide hotline, 988, which is a wonderful resource that you can call, that a parent can call, that a child can call at any time and get connected with a crisis response professional. Those are staffed locally. And so that means that they can get connected with local support. It's not some national call center that you'll be contacted or that you'll be contacting. So certainly you can call 988. You can also, certainly there are local child crisis centers, and those, here in Louisville include 7 counties, the Brook, the Peace Hospital. Those all have acute child crisis services. Our emergency departments or other resources. But more largely, if you don't have immediate concerns for your child's safety and are just trying to get a kid connected with a mental health provider, your pediatrician is a great place to start. Pediatricians are kind of the experts about resources in the community. And if they can't help, they know someone who can. They also know your child well, ideally, and they've been following them over the course of the development. So they can also do that assessment or that functional assessment to determine what level of care your child might need. And then more and more, as is certainly the case in my organization at Norton Children's, we actually have behavioral health providers embedded into primary care practices to help with that support.
Well, we'll be back in just a minute. You're on track with Louisville Public Media. Welcome back to On Track. I'm Aisha Jaffer, and we are talking to Dr. Katie Hopkins, Executive Medical Director of Pediatric Behavioral Health at Norton Children's, about children's mental health and how parents and caregivers in Kentucky can better support the young people in their lives. You know, there's so much media in the world and so much going on in the world. And I know social media can often give access to kids to these bigger issues and a lot of different things that they're exposed to. So how is social media shaping young people's mental health, and how does that impact look different for younger kids compared to teens?
So I think that the assumption, what psychologists might say, like common sense assumption about the impact of social media on kids and adolescents was that it was all bad, right? But the reality is that it's way more nuanced than that. Social media can really provide a connection to communities that, especially if you live in rural areas or you're from an identity that's not well represented in your community, it allows you to access other members of that community in other places and help you form bonds and connection. It helps, kids feel seen. It helps them maintain connection even with their friends that are in real life. We all have experienced that if we are on social media. But we also know that, some of the downsides is that it's a curated experience. We as, people that engage in social media, that have our own accounts, we curate that content. But sometimes we forget that it is curated also for us. And, I think that largely we discount that actually teenagers are pretty smart about that. I think that we think how long has this been true where adults think they know better than teens about certain things? But I think that teens can be quite critical of social media and the content they're getting, but they can also be caught up in it, and they can forget that it's an algorithm. They can forget that it's a money-making machine, right? And that social media is designed to make money off of what, their behavior and what they do. But certainly, so it tends to, at least based on what we currently know, tends to impact teenage girls more than boys. And that can lead to increased anxiety, depression, eating disorders. Certainly, depending on the group, just like in real life, your peer group can impact your behaviors, can impact your view of the world. In social media, it can do that too. But unlike in real life, there's less guardrails around it. There's less adult supervision. It's like, I remember when I was a teenager, we had a strict rule in our household that I couldn't go to parties where there were no adults. But essentially, social media is like an endless party with no adults. They are engaging in risky behaviors without, even if it's just observing those risky behaviors, and endorsing those risky behaviors without a parent stepping in and being like, that's not allowed in this household. And as a parent of two teenagers myself, I know that it's easier said than done. I'd like to think that I am still closely monitoring their online behaviors through all the parental controls and our own personal relationship around it, but it can be hard.
So if listeners want to keep learning or know where to turn as far as resources go, when we're thinking about mental health as a whole in Kentucky, social media and all, what would you recommend for their mental health toolbox?
Well, So are you asking about specific support resources or what they can do to take care of their own well-being?
I think what they can do to take care of their own well-being. And I know we talked
Yeah.
about some resources, but if you have more, absolutely.
Yeah, so let's start with what they can take care of for their own well-being. Really, protecting routines is so huge. Learning how to have, I was thinking about this earlier, learning how to take care of yourself and prioritize going to bed at the same time every night, brushing your teeth, putting your media away or screens away before bed. We're all trying to do that as adults, but helping kids really protect their sleep, their eating, and their exercise, those are just foundational benchmarks for well-being. If those aren't taken care of, all of the great therapy in the world is not going to help if you're underslept, underfed, and not moving. So those are just some real crucial things that you can do on a very basic level.
And then any other resources locally?
Yeah, so I think certainly your local community mental health agencies like 7 counties here in Louisville, that's a great resource. Psychologytoday.com is a great resource. That's a national resource, but it kind of is like a dating website for therapists, where if you're looking for a therapist, you can search by zip code, insurance, age range, gender, all of those things that you're looking for, and then you see their profile and you see what they do. And that can be a great way to find a local therapist that fits exactly what you're looking for.
Well, thank you, Dr. Hopkins. Everything you've brought to us has been incredibly helpful.
Thank you, Aisha.
Dr. Katie Hopkins is the Executive Medical Director of Pediatric Behavioral Health at Norton Children's. She's a licensed psychologist specializing in children, adolescents, and families with a doctorate in philosophy and a master's of education from the University of Louisville. On Track is a production of Louisville Public Media. The On Track production team includes Michelle Tyreen Johnson, Alex Biscardi, and Laura Ellis. Our music is by Kojin Toshiro. If you'd like to revisit this episode or explore other community-focused conversations, visit LouisvilleOnTrack.org or find us in your favorite podcast app. Have feedback or ideas for a future show? Connect with us at 502-814-TALK or ontrack@lpm.org. I'm Aisha Jaffer, and remember, being kind is free. That's the start of community. Until next time, you're on track with Louisville Public Media.